Okay, fantastic. So I have a very special guest who I'm going to bring on right now. Her name is Shannon Pinkerton. She is a doula, and I love doulas. And the doulas as a profession, as a group, and what they do for women. As a midwife myself, who's used doulas for my births that I attended, as well as my own children. I was just so excited to meet Shannon, and I'm going to bring her on so we can talk to her and have her tell you a little bit about herself, and then we're going to go ahead and answer your questions. You guys have a lot of knowledge in the room tonight. Between the two of us, you got a lot of support. So hold on one second while we bring Shannon on. And this is her very first time doing a live stream, so she's very excited to do it, and I'm excited to have her. Hi, Shannon.
Hello, how are you? Hi, everybody.
They're all excited, and I'm so excited to have you here, and welcome to our show. Welcome.
Thank you for having me. Thank you.
Our complete pleasure. Shannon and I got on the phone, I have to tell them, this afternoon, and then it was like an hour into the conversation, it was like, okay, we are long lost sisters. We are meant to be doing something together, and everybody's saying hi to you. Yeah. Everybody say hi to Shannon.
Hi, guys.
So now, the way that I met Shannon, now many of you guys remember last week we had our amazing episode with the creators of When the Bow Breaks, and Lindsay Gerst was on with us, and Shannon was Lindsay's doula and was actually in the film. So I got to see Shannon last week when I watched the movie, and today I got to see her. So I feel like you're famous seeing you from the movie, and now you're here.
Yeah. Being in Hollywood for 15 years, and I always avoided that, and somehow now it's happening.
I think if you just hang around Hollywood long enough, you will end up in a movie, right?
I think you're right. I think you're right. Yeah. We see lots of friends popping up all over the place on all different shows. Yeah.
That's so funny. That's so funny. Well, no, we loved that episode with Lindsay and Jamie Lynn and Diana last week. And for any of you guys that missed that, you have to go back and watch the replay. It was actually episode 100 of My Baby Experts. It was like a really awesome milestone for us. But the main thing was just, sometimes you just do these topics that are so meaningful and are going to just help so many people. And that was just one of them. That was it. And it's not the end. We're going to do more. We're going to have Lindsay back. We're going to be doing a lot of really amazing stuff in the weeks to come to keep the attention going on postpartum depression and the support that moms need after, during birth and after delivery, and sometimes for years to come. So, yeah. So Shannon, tell us a little bit about yourself and Dream Team Doulas, which is your company, but I'd love to just let the audience know a little bit about your background and you. So.
Sure. So I, like many people in this field, was kind of called by destiny. My first birth was when I was 15, my little niece, who's going to be having a baby in May.
Awesome.
So super excited to have that go full circle. But I had a passion for birth, and then when I gave birth to my first, my daughter, I thought I was, when I'm a birth doula, I'm good, I got this. My husband's a doctor, we're gonna be great. So I had everything in the room, just her little shoes lined up and her outfits, and I thought I was gonna bring home a doll, and everything was going to be amazing. And I had a really rough time. I did have postpartum depression, and it went untreated because I didn't really know. I was kind of in denial. I didn't really know the signs back then. Yeah. But it pushed me from birth into postpartum. And it's been very, very healing and very gratifying to be able to help women who are in this dark place, and even if they're not in a dark place, just kind of help empower them, help support families, strengthen families so that they can thrive. And it's been my passion. It's been my reason for everything. And I I'm just honored to be able to do the work.
So when you say it moved you from birth to postpartum, you mean it moved you from attending births as a doula to attending as a postpartum doula? I just want to clarify that for a lot of people don't. I mean, we're so involved in the in what goes on and what the resources are that are available to women, but a lot of women don't realize that there is support, and and having a midwife and having a doula are two totally separate things. And like, I get that all the time. Like, so are you a doula? I'm like, no, I'm not a doula. I'm a midwife. And so I
get the same question. So you're like a midwife? No, I'm not like a midwife.
Yeah, totally different. I know, like in my practice, when I was a practicing midwife, when I was doing births and seeing patients, one of the things that was a requirement in my practice was that you needed to hire a doula as well, because the kind of birth that you wanted to have, the kind of support required more than just what I was doing, and it's a totally different thing, which we're going to get into in a whole other show. I think maybe next week or the week after, we're going to have a whole show just on doulas, like what it's about and what kind of care that moms can expect. But what Shannon's describing is that, you can have a doula, a postpartum doula that comes to be with you after the baby's born.
Mm. Right. Yeah. We help with lactation. We help with first bath, just all the little firsts that are a little bit scary when you're doing it for the first time. Transition from, if you have a hospital birth, you've got pediatricians and nurses on call with a little button, and they're just a little button push away, and then you go home and it's just a little bit scary that you're in charge of this little life. So we help with all the little firsts and transition you in, build your confidence, and then ultimately get mom in touch with her intuition, which is more than,
Well, we all need that support. I know I really needed it after I had my kids, and even with all my knowledge and training and all that, it kind of goes out the window when you have your own babies. And it makes a huge difference to have that support. So tonight we just have a ton of questions, and I just wanted you to come be with me and help me answer these questions for all these mommies out there, because they're struggling and we know how they feel, and it's hard. It's really hard. And one of the hardest things is just getting the right information so that you can understand, like, am I doing, everybody wants to do the right thing. I mean, we all want to do the right thing. And sometimes it's just a matter of, getting a question answered that you've been struggling with and you don't know where to turn to get the right answer, someone that you can trust to answer it. And I think that's why a lot of the moms tune in here. And let's get some hearts if that's the reason you come to see us. And you'll come to show us your hearts. I see some hearts going across the screen because it's the reason I put on makeup at 9:00 at night.
My husband's excited. I don't know. My face is like, oh, I got makeup on at nighttime,
but you need to go out after this. So it's like, you're on the internet and you're looking at these ladies sitting here on the screen and you're going, oh, okay, do I listen to people sitting on the internet? And the answer is, at least that this is not what we did this is not what we did as our careers. We are here to support you, the same thing that we do with moms in person, the same thing that Shannon does every day with moms, and what I have done for many, many years. So hopefully our answers will help you tonight. And we're just glad to see you all. I don't see any hearts, so I don't know if it's just my Facebook. Are you seeing hearts, Joe?
Yeah. I see a heart.
Yeah, I'm not seeing any. I think it might be my Facebook. I don't know. Okay, awesome. Excellent. Okay, so let's.
Now there's an explosion of hearts.
Okay, I can't see any. Okay, what?
Hit a heart.
Hit a heart. Okay, Joe's telling me how to do this. Hold on. It's not doing. Okay. What? How do I do it?
No.
Okay, yeah, I see it, but I don't. Okay, I'm gonna go into a. You know what? I'm in this stupid Pages app. That's the problem.
No.
Oh no. Okay, everybody bear with me and my own stupid technology tonight. Hold on. Because I can't, I cannot do this without the hearts. Like, I literally can't. So I'm gonna hold up the entire show right now for my own benefit so I can see your love. But it's really all of our benefit. Okay, let's see if that worked. Okay, now everybody go ahead and do hearts so I can see it. Oh, Lindsay's in the audience saying hi. Hi, Lindsay. Oh, there's the hearts. I see them. Okay, I see the hearts. I'm good. Hi, Lindsay. Look what you created tonight.
Hi,
All right, awesome. So let's answer a few questions. Now I see hearts. Yes, keep them going. Wonderful. Thank you. All right, it was just I was using the wrong app. That's all it was. Okay. So I have a question that came in from somebody named Jessie. Okay, Jessie said she's currently breastfeeding her 10-month-old. She needed help to take Clomid, which is a infertility drug, to conceive. She'd like to conceive again, and she's thinking about starting to try the next few months, but she doesn't want to take away from her little one who's still breastfeeding, who's 10 months old. Do you have any experience with this? Any recommendations? I know that this can decrease milk supply, but what I've also read is the studies were done when breastfeeding was well established. Any information or experience you would be appreciated. So totally understand, that if you struggle to conceive the first time, you don't want to wait too long to try again. And she didn't say anything about how old she is. So, and depending on your age, you don't want to put it off too long. But here's my thought, and you could tell me what your thoughts are on this too. But my thought is that, your baby is 10 months old. It may take you a few months to actually conceive, but how about waiting another 2 months just to get to that year? Babies need to have it. They have to have either breast milk or formula in that first year. Like, there's no other option. And you're so close. Like, I'm thinking Jessie's so close to the year. I don't think that the extra 2 months is really going to make that big of a difference in her fertility issues. If there is even going to be an issue again anyway, there may not be. Clomid's just, not that we're not talking about IVF or anything like that. So my advice would be to wait till at least a year to start again, just in case you're just one of those moms who early pregnancy makes the milk supply decrease to a point where you'd have to do something else.
Yeah. I 1,000% agree. Yeah, you've got just 60 days. That's it. Just 60 days. You can do it.
That's a good way. Just 60 days. It's just 60 days. You made it.
It's just a few weeks. You're good. You're good. Yeah, that's what I would suggest as well. Just then you don't have to complicate things and have another choice to make, which would be possibly supplementing when your breastfeeding career is already going amazing. So
Totally. I love that. It's just 60 days. That sounds like even a lot less time. So there you go. And, congratulations. Good for you, Jessie, that you made it this long, and keep going, because your little one still needs you, and it is possible. Some moms can tandem nurse through their entire pregnancy with no issues at all. Other moms will see a decrease in supply once they conceive. And so you don't know how quick that can happen, and also how the Clomid could affect your prolactin levels and your hormones in general and all of it. So 60 days. I like what Shannon said. I'd wait. Hearts for Jessie. This is the rule here when we do our Q&As. When we answer someone's question, so Jessie gets hearts now. Everybody gives hearts for that mommy who asked the question, and everybody gives hearts for the two of us, for Shannon and I, answering the question, okay?
So, pay us in hearts, ladies. Pay us in hearts.
What I always say is, this is love coming out in words. And, that is really what we're doing here. I promise you that every single time I turn on that camera, every single time that I sit here and do this with all of you, it is truly out of love for parenting, for people, for moms, for babies, and for the experience that you're going through, that I know that you're going through, and what I know I can offer you. So this is my love coming out through my words, and then I love to feel the love coming back with the gratitude and and knowing that it's supporting you in some way. And when we do this on Facebook, it's in the form of a heart. That's all. If I was in front of you, I would hug you. If I was next to you, I would hug you, because
yes.
Hugs. We do hearts. Hearts instead of hugs, right? Okay. Lindsay, when we were talking earlier, you had mentioned that you have some sleep, that you also do sleep training. And that you work with parents on supporting them with your own sleep methods, and that's like a non-cry it out method that's different. And I have a question that came in from Tracy, and I see even Tracy's in the room right now. So I'm going to just bring up the question because it's kind of a two-part question. And the first part I'm going to answer for her about breastfeeding, but then I'd love for you to share a little bit, maybe some tips or advice about sleep. So let me just read her question. The question was, the only way I can get my 4-month-old to sleep is by putting her on my boob. We all know that. I had 2 of those. I've tried swaddling, rocking, bouncing, the magic sleep suit, white noise, walking, pacifier, and am I missing anything? She still eats every 2 to 3 hours throughout the day and all night. Do you think I'm not producing enough milk? I read she should be sleeping at least 6 to 8 hour stretches by now. I know my older child was sleeping 10 hours by 4 months. So I'll take the first part of this question because here's the deal, Tracy. With a 4-month-old, it is extremely normal for that baby to be eating every 2 to 3 hours and eat, throughout the day and night. Every baby is different, and so, but it's not unusual for them to eat every 2 to 3 hours. Breast milk is digested very quickly, which is a good thing, which is what we want. It goes through them fast and it makes them hungry again. And eating frequently, like smaller, frequent feedings, is ideal for their development and their growth, as well as your milk supply. So you don't want to interfere with that. And it's really hard with a second baby because you're really comparing. It doesn't mean that there was anything wrong with your older one who slept 10-hour stretches. That's just what your baby did. And when you compare it and we have our second child, this typically happens where we think something's wrong because it's different. But there's nothing wrong. And, unfortunately, it's a hard question because moms want to sleep and they're tired, but really breastfed babies, especially at 4 months old, that's what they do. So with that being said, I don't think there's anything wrong with your milk supply. I don't think at all that you have to do anything about it. I'm assuming everything else is normal, meaning wet diapers, poop diapers, growth, babies gaining weight, and all those other things. And the 2 to 3 hour stretches are extremely normal. So, but then I want to hand it over to Shannon to maybe just even talk a little bit. Any tips will help them, and we'll do another whole show on sleep coming up, but
sure.
I'd love to answer Tracy's question a little.
So for my sleep, when I get calls on sleep, it's almost always a mommy with a 4-month-old. Always 4-month-olds. Like I hear from a lot of 4-month-olds, and that's because their sleep is shifting. They're developing more into cycles of sleep instead of immediate REM, like when they're a newborn. So what happens is this causes a sleep regression. I have some babies that are sleeping 10 hours, through the night. And then at 4 months, all of a sudden, up again every 2 to 3 hours. And I think the most important thing that I can share on that is babies are constantly changing, especially that first year. Their brain is growing, the neural pathways are firing, there's so much going on. And there's these little checkpoints along the way that we think, oh my gosh, what am I doing? What's wrong with the baby? How come we're backtracking here? And a lot of times it's an internal regression, even if your schedule's great, even if your feeding is awesome, you can still see the regression in sleep. So don't get discouraged by that. And I always say, just give it 2 or 3 weeks. Like you don't always have to do something about it. sometimes it just really corrects itself. And the best thing that you can do externally probably is just stay regulated in the schedule that you're already on and do all the things that was, working before.
Yeah.
And again, I know it's really hard, but try not to compare, because everyone just because they're little doesn't mean they're not people. Like, we're all so different in so many ways. And infants are no exception to that. They have their personalities, they've got their preferences. And so I wouldn't worry too much about it. And maybe what you could do is just take a look at the daytime schedule and see, if there's any inconsistencies there, because the best thing you can do through a regression is just stay consistent instead of change. That's kind of when we want to change something because we think it's going to change the situation. But in reality, when there's a regression, it's probably best to just stay focused on where you are, and then the baby will catch up.
Yeah. No, it's so good to know that, and there's milestones that they hit, like you're saying, same thing happens with breastfeeding. They go through certain growth spurts, and there are certain changes that occur at certain times that we kind of expect certain, growth spurts that occur at like 3 weeks, 6 weeks, 3 months, 6 months, and not always at the exact moment. But what you're explaining about sleep is that we have those same stages that they go through at certain times, and a 4 months is a time you get the calls, just like I get the calls at 3 weeks that, I'm not making enough,
Right.
It's the same thing.
Really, everything's just adjusting. You're just not as swollen.
Right.
But absolutely. And I think one of the hardest things is to kind of relent control and be okay with these shifts and these changes that happen. And no, you don't necessarily have to do anything.
Yeah.
You just take it day by day. And as awesome as like sleep and schedules and all that is, really to be flexible and really just give your child the space to grow, which is really what's happening. It keeps everybody sane, you don't always have to do something.
No, absolutely. So we want to do something, but sometimes they're doing what they're doing because it's what's normal, and we need to just, it's like we're the ones that actually need to learn what the body will naturally do, what your baby's body will naturally do, what our bodies will naturally do. This happens through pregnancy. Basically, you're a bystander. I mean, when you think about pregnancy, you're a bystander to pregnancy. We go for prenatal visits, we eat really well, we do all these things, but basically all we're doing is sitting around and watching it happen. I mean, no one's doing anything. The body knows exactly what to do, and that doesn't change once you go into labor. That doesn't change once you have your baby. Your body does know what to do, and instinctually, you actually do know what to do. It's when you start second guessing and doubting and questioning, or telling yourself that you really don't know.
Right.
We talked about this recently. I think it was, I don't remember when, maybe 2 weeks ago on another show. And it's just so interesting how, that voice inside of you that tells you, I think this is okay, but that's the voice that you really need to be listening to and getting information. No one's saying don't get good information, but it's also really important to pay attention to that inner voice too. So it's there.
Tracy, not to say it's not hard. I know it's exhausting sometimes. And that's when, you pull support. Maybe you're having a rough time and grandma comes to visit for a week, or, you find someone to help you, for the night shift so that you don't get too overtired yourself. But, that's just taking care of you, and the side effects are happening to you, not really changing, stuff up for the baby.
I think that it's really important to look at what are the things that someone can't replace. So to me, when I think about Tracy here, the two things that cannot be replaced is no one can feed for her right now because she's breastfeeding, and no one can sleep for her. She has to do the sleep herself. So those are the two things that cannot be like no one can stand in for. She's got to take those naps when the baby's sleeping, and she's got to feed the baby when the baby's awake. But basically everything else you can get support from other people. So if it's your older child, getting someone in to support you with that, even if it's just for a couple hours a day where you can get that 2-3 hours of sleep when the baby's sleeping if you got an older one, or if it's somebody to come in to just help you just do some of the laundry or catch up, and you really do need to ask for support with that. So and then just realize that this is what it is to have a baby, and it doesn't stay. I say to them all the time,
it's the best and worst time of your life.
Exactly. Eventually they turn into teenagers, and then you wish they would get up. Now they sleep all the time.
You train the team. You're in for a sleepless night. You're going to have sleepless nights no matter what, guys. Sorry to say.
Exactly. All right. That's great. Let's get some hearts going for Tracy. I see Tracy in the room. She just said thank you. So thank you for sharing that with her. Mwah, Tracy. Hearts for Tracy. Okay. Let's go ahead and go on to the next question here. This question came in from, let's see, Brittany. Brittany said, I've been taking vitamins daily, drinking mother's milk tea, using brewer's yeast, eating oatmeal, drinking at least 120 ounces of water, eating flaxseed, and pumping every 2 hours with a 5-hour stretch at night. But I'm still barely making enough to feed my son. Any other tips to increase my supply? I exclusively pump. Only about once a day he will latch on for about 20 minutes or so, and I will pump right after he nurses. She's got 3 different pumps. Okay, so I had written back to Brittany on the page, and just because I needed more information to answer this, and I didn't hear back from her, but I do want to go ahead and answer it in a more generalized way, okay? Because I really don't know what the situation is, and is it really true that she's not making enough for her son? When I read this question, the first thing that comes to mind is she's exclusively pumping, so she's looking at the milk. This is where we can get into issues. When babies are feeding at the breast, you're never really seeing how much they're eating. You're measuring other things. You're not measuring ounces. But when you're exclusively pumping, you are looking, or even if you're not exclusively pumping, but maybe you're back to work and you're pumping a few times a day. Whenever that milk ends up into a bottle, you're quantifying how much they're getting by how many ounces they're eating. And then you're associating that with your own idea of like how much should they eat and what is a sign that the baby's still hungry. So this is really important to like consider, because when you say, when Brittany says she's barely making enough to feed her son, my first question is, how much is that? And are they pacing the feeding, whoever's feeding her son, whether it's her or a caregiver, another caregiver, are they pacing those feedings? Are they allowing the baby or her son to control the speed in which the baby's eating versus pouring it down their throat? Because let's face it, with a bottle, you can really pour that down and they'll eat a lot more because their reflex is to suck and keep on swallowing. And when it's pouring, they have to swallow or they're going to choke on it. So you can actually control the feeding versus the baby controlling the feeding. So I would really encourage to really look at, when you say you're not making enough, the fact that she could nurse at the breast, that he latches to the breast once a day for 20 minutes, and then she's able to pump right after that nursing, kind of gives the whole thing away right there. That the fact that she's able to pump after a feeding, you're making enough milk. That's my feeling. And if you think you're not, then my next answer would be, instead of all the different things you're taking, the number one thing that really does increase supply, even though all these other things are great, is more stimulation, more draining of the breast. So I would think to possibly, narrow the time between pumpings a little bit more. So if you're pumping, say, 6 times a day, increase that to 7 times a day and keep the breast drained as much as possible. It'll actually accomplish 2 things, which one, it will give you that extra pumping session. So overall, over the 24 hours, you'll have more milk to feed your baby. But also, by keeping the breast empty all the time, it actually has the effect of telling your body to make more milk. And so this is where moms will kind of take the opposite road, where, you know, they think, oh, let me wait till I feel nice and full, and then I'll pump or feed. You know, oh, I feel kind of empty. It's not time to pump yet. That's not true, because every time the breast fills up and gets really full, it's actually signaling your brain to make less. Every time the breast is drained and constantly emptied, it will signal your brain to make more. So it's the opposite of what you think. And I would never let the breast really feel full. I go ahead and keep pumping frequently. And you don't have to do long pumping sessions. They just, if you're using a good pump, if you know how to use the speed and suction dials, and you know how to stimulate a letdown effectively, then the pumping session shouldn't take very long, and I would do them more frequently. Yeah. So, can you say something?
Yeah, no, agreed.
Agreed.
Absolutely. Yeah.
Okay, we're in agreement about that. I mean, it's hard to tell with this, but that's my first answer to that. Speaking of pumps, so we started a giveaway this morning for the Even Flow feeding pump. I'm not going to announce the winner right now, but we had 100 people. There's over 100, like 110 entries. Since 10 o'clock this morning, there's been 110 entries, and anybody's watching tonight, if you have not entered for the pump, there's still time. I'm not picking the winner till later tonight and announcing it tomorrow. So you can go over there right here on my page, just down below after we get done with the live stream, and still enter to win the Even Flow feeding pump. And we're also giving away an accessory kit for anybody who owns the pump. But let me tell you something. So it's not about the giveaway, but reading the comments of like everybody knowing what to look for in a breast pump and explaining the features on this pump, I have to just say to my crew here, okay, that I'm so proud of all of them, because they're actually listening. Now I know they're actually listening to me every time I talk, and they're typing away and telling me the features and what they should be looking for in a breast pump, and what that they need, and why they need it. And so I'm just very proud of all of them. I just wanted to tell them all that, because I was so excited reading all the comments. And yeah, so go enter if you didn't win.
Yay, listening.
Somebody's listening to me. Yeah, my kids don't listen to me, so at least I have a lot of people who actually want to hear what I have. My kids are like, okay, stop talking.
Right.
Everybody else is like, tell us more. So I get that outlet here, you know. But my kids don't want to hear about breast pumps, and I'm really good about talking about breastfeeding and breast pumps. There you go. And birth.
Not boobs again.
Joe said I'll listen to you. He does. He listens to a lot of it. 20 years of birthing conversation.
Oh,
Poor guy.
awesome.
He loves it.
Obviously.
He obviously loves it. Oh my goodness. All right, let's move on to the next question here. So this question, okay, this was actually probably a good question that maybe you could take. This came in from Alicia. She said, "Hi, Shari. This is my second pregnancy, and I will be 38 weeks tomorrow, and I'm ready for baby to be here now. With my son, I didn't have contractions start until after my water broke, and he was born at 37 weeks and 2 days. Are there any signs of going into labor besides contractions that I can look out for, since this pregnancy seems to be going a lot different than with my son's?"
Well, I don't know. As a doula, there's always like this look, like it is just this very subtle. I don't know. You know what I'm talking about.
I do know what you're talking about.
There's just something off. Something is just a little off, and you know, don't quite feel 100%. Energy might be low. I know a lot of women might experience loose bowel movements before they have a full contraction. But there's just this really like low grade just feeling of just not 100%.
Yeah.
And that usually like the last week, like of course the last 4 weeks you're just feeling like someone pumped you up with the air, with a tire pump, and so you're not sleeping well, not feeling well, but just like 5 to 7 days, I feel like before you go into labor, there's just a little shift. Definitely. And there's just a little shift. You just really feel things change a little.
I think labor's not like this moment in time where it starts. And I think that's what you're basically getting at, is that it's not like the switch goes on, you're in labor. Yeah. It's sort of this continuum. Like it's a process that starts off, and you might not notice the beginning of labor. And I'm not just talking about, early labor. I'm talking about the pre-labor. There's like a pre-labor time where what you're just describing of like, just feeling off, just not quite, something's not quite the same anymore. And it could be that you're either feeling sluggish, but could also feel more like you're even more awake. Like people differently, So looking for some kind of a change in your overall feeling of, overall body feeling, could be a real signal that something's about to start. And then there's some physical stuff too, like, you might notice that, you're feeling some pressure, it might not feel like contractions. It doesn't feel like contractions to everybody. It could just feel like some back pain, Right. I've been having back pain for the last 2 days. No, actually you're in labor.
Right. Sometimes it's a shift the baby, and you just feel like the baby's just in a different place. Yeah. And, a lot of it is just so super subtle. And like what you said, it could take weeks. I mean, it's really this process that we don't get to choose. It's not us, it's the baby. It's the baby when it's time to come.
Yep. Or, with the second baby, it can go a lot faster. Usually it does. A sign that things could be happening could be a little bit of a bloody show, which means that you may be dilating, and that can happen without any without feeling any contractions. So the cervix can start to dilate, you face, and get thinner and open, and sometimes you'll see a little bit of bleeding with that, and that could be a sign that, labor starting. So that could be one sign. It could be that your water breaks, but doesn't have to happen. That was how my labor started. The truth is exactly what you described, that feeling, that overall feeling of like something's not right. I remember with my first baby, I was like a week early, and one night I just said to Joe, remember Joe, the whole night we were eating dinner, and the whole evening I'm like, I don't feel good. I just don't feel good. I'm like, I need to like get in the bathtub. Like I don't feel good. We lived in this townhouse. We had this like tiny little bathtub, and I never take baths, but for some reason, like I really wanted to submerge my body in water. Like I had this overall need to get into water, which is what you're describing, like something's different, And I went and got in the bathtub, and Joe came in, and he's laughing over there right now. Because he walked in the room, and I'm crying, and I'm sitting in this bathtub because I was so desperate to get my belly, which was so big, under the water, and I could not fit into the bath. So there I am. With the belly out of the water. I'm like,
a bit floaty. The floaty just did not want to go down.
I can't fit in the bathtub, and I really want to fit in this bathtub. And he was like, okay, I think you need to get out of the tub. And then my water broke like 10 minutes later.
Oh gosh. Yeah, that's a perfect example of like, I gotta do something. I gotta take a walk. I gotta, and everyone's different. Like how you said, sometimes it's a burst of energy. Sometimes you start cleaning. I know I've had friends that just go on a cleaning spree and start scrubbing with a toothbrush, Yeah. And then, like me, I was just like, very much like you, get me in water. I lived in the pool. I just lived in the pool the whole last month.
So everybody's got their own feelings of like what they want to do, but I don't think I've ever told them about the bathtub story there. My bathtub story. Yeah, I got some stories I got to tell them about. All right, let's move on to another question here. Let's see. This question came in from Ashley. Ashley said, I have a 4-week-old boy-girl twins who I nurse exclusively. Awesome. My daughter's dirty diapers are typically breastfed bowel movements, which I'm assuming yellow CD. My son's have been green and liquid for the past few days. At first, I thought there was an oversupply, like fore-milk, hind-milk imbalance, but he nurses longer than his sister and has a better latch than her. Could he have an allergy? He's typically pretty gassy also. I hate to supplement him with formula if I don't have to, but I don't want him to be miserable and have diaper rash irritation often either. Should also note that he's growing and gaining weight okay. All right, so definitely formula is not the answer to this question here. So that would be like the last part of, that would be the last place I'd go, because my thought is, if he's nursing long periods of time, most likely it's not the fore-milk, hind-milk imbalance that she's describing, but more that the baby may have a cow's milk sensitivity. And that can cause the stool to be green. So sometimes that just, what the green stool can be is more of an irritation of the bowel. So if the poop starts to turn green, they're very gassy, they're very uncomfortable. Something in what you're eating could be affecting that. And I say cow's milk because it's the most common one to look at first. Many human babies cannot digest the protein that's in cow's milk. And so and it's not your breast milk. And this drives me crazy because I read a whole thing the other day, people talking about being allergic to breast milk. It's not the breast milk. Babies cannot be allergic to your breast milk. Okay. It could be something you're eating, like the cow's milk that you're consuming and what's going through into your breast milk that the baby could be intolerant of, but it is not allergic to your breast milk. Breast milk is practically this. It's so closely genetically identical to the baby. It's actually made for that baby. It's impossible for them to be allergic to it, but they can be sensitive to what's in it. So sounds like your daughter doesn't have that, and your son may have that. My suggestion would be to cut out all dairy for several weeks. It may take 3-4 weeks for it to completely come out of the milk before you see a full improvement. It may not be that long, but you have to cut it out for several weeks before you can tell the difference. That should usually help the gassiness or that fussiness that he's having. He's not having issues with weight. I would just do that. I mean, that seems like the answer to me.
Yeah. I'd like to add that it might be beneficial to look at some probiotics until that transition is complete.
Yep, absolutely. The probiotics are going to help to establish the gut bacteria to babies need good bacteria in their body to keep them healthy, to keep their digestive system working, and to help their immunity and prevent them from getting sick. And that's a whole other conversation. We should do that as a whole show, just the microbiome, just the whole birth and C-section. The whole thing's so fascinating, and then how it continues on afterwards with skin to skin and with breast milk and all of it, and how that really impacts their overall health immediately and then long term as well. So let's write that down. That's going to be a whole topic. We need to talk about. It's a good topic, right? We haven't done that. I really want to talk about that one. Maybe we'll do that together. Okay. Hearts for Ashley. Thank you, Ashley. And great job nursing your 4-week-old twins exclusively. Very happy for you. That's a big accomplishment. Okay. Next question is from Stephanie. Stephanie here tonight. Stephanie's usually on with us. So Stephanie said, my pediatrician was worried about weight loss at our 4-day checkup. Baby Bradley was 9 pounds at birth, and they were worried he lost 10%. So they had her give him 1 to 1.5 ounces of formula after each feeding to supplement. He's 13 days old now, and he's been gaining weight with only 1 ounce supplemented after every other feeding. I don't want to give him any formula if it's safe to stop, but how do I wean him to exclusively breastfeeding and make sure he's still gaining? So first of all, 1 ounce of formula every other feeding is a very small, it's two things. It's a small amount and it's a large amount. It's a large amount where you should try to wean off of that. If you're let's say this, it's a small amount in that if that's all you're doing, you could probably do none. That's what I want to say. That's how I want to say it. If that's all you're feeding the baby, and then you calculate that if the baby's eating, say the baby's eating, 8 times in a day, or 10 times in a day in a 24 hours, that means the baby's eating 5 ounces of formula total the entire 24 hours. You probably don't need any. And at this point, the only way to go to exclusive breastfeeding and to wean off that formula is to just stop using it. Okay, you are obviously producing because that baby's only getting 5 ounces of formula a day. And if you were to just feed a little more frequently, and which will probably happen when you stop that supplementation because the baby will be hungrier to eat at the breast, the baby will remain hydrated, and the baby doesn't have to gain that much weight. So see, this is where, unfortunately, sometimes the question that we're getting is not fully the answer we want to give, because we don't need the baby to gain a tremendous amount of weight. Okay? Breastfed babies gain somewhere on average, and I say this on average, somewhere around 4 to 8 ounces a week on average. Okay? That's not an ounce a day, okay? That's a half an ounce to an ounce a day on average. And some weeks they gain nothing, and other weeks they gain twice that amount because they go through growth spurts. So I would say baby Bradley could probably just go straight to breast milk right now. As long as you're watching wet diapers and making sure you're getting 6 to 8 wet diapers every, in 24 hours, nice, good wet diapers, nice yellow seedy stool, and the baby seems satisfied after the feeding, even if he's eating a little more frequently, and you're hearing good audible swallows when he's at the breast and all those other things, I wouldn't worry about his weight. Not right now. That's really not you can't tell, and you shouldn't be weighing the feedings and all these other things. So the thing to do is to just start cutting it out. If you feel more comfortable, cut it out 1 feeding a day for the next 4 days until you're feeding none. Do it a little slower, and then just go to straight breastfeeding, because I think you're doing fine. Of course, always check with your pediatrician, but that's my advice. That's my advice.
He's not growing because he's getting 5 ounces of formula. He's growing because he's a good nurser and getting enough from you. So you are enough, just you.
Exactly. This has always been the case. These questions about, I'm told to I'm feeding 1 bottle of formula a day because my baby's not gaining fast enough. And if you're only at 1 bottle, you probably don't need any.
Yeah. Agreed.
And that 1 bottle of formula can actually really impact your supply. It's very heavy. The baby will sleep longer sometimes and not eat and not be as hungry. You're substituting what they should be eating at the breast. And so your body's just reacting perfectly, which is, it's only going to make what you tell it to make.
Right.
Doesn't know that the baby got a bottle of formula, so it's not going to make that milk. You need to be demanding it from your body by feeding or pumping in order for your body to make what you want.
Mm-hmm. I think it all goes back to that natural dance of your body knows what to do for your baby. Yes. And most of the time, even baby knows what to do.
Yes.
We just need more confidence in ourselves and our ability to follow through with our instincts and kind of remove some of those fear,
Yes.
those fear that comes from reading or talking to friends or your pediatrician. If your baby's growing, you're doing good. You're doing good.
Absolutely. Absolutely. And growing, is like a spectrum of growing. There's not like some babies are smaller, some babies are bigger, some babies gain faster than others. I'm always looking at the whole picture,
Yeah.
babies growing, going in the right direction. It may be slow, but it's still going in the right direction. Babies hydrated and hitting milestones and appropriately doing what they're supposed to be doing. There's no like set amount that the baby needs to be gaining or growing. It can go slower and still be normal. And then you look at the parents and you've got two small petite parents and you wonder, why is this baby so small? And you're like, oh yeah,
okay. Exactly. Yeah. I do the same. It's really, going back to, they're just little people. I know they're babies, but they're actually individuals.
Yep.
And I say, pediatricians are obsessed with the scale. They want to, because they want to make sure the baby's growing. Yes. But sometimes they don't look at the fat rolls.
Yeah, exactly.
And you know what? If the baby's got little folds and little fat rolls and you've got a little
Totally. Babies that's so perfect. They've got all this subcutaneous fat. There are these little tiny, petite things with rolls on them. That means they're doing well. That means they're doing. So if your baby's got a little double chin and is just like lower on the growth curve, it's okay.
It's okay. Some of us grow up to be 6'5". Some of us grow up to be, 5'4". Just, we don't all grow at the same rate, and we're not all the same. So I like to put that on the individual scale as well.
Totally. Perfect. That's great advice. Awesome advice. Okay. Hearts for Stephanie. Okay. And congratulations on the baby, Stephanie. Okay. Let's see. Dominique asked, how can you be sure that your baby is getting enough breast milk when she's at your breast? And how long should she be at the breast? I've been exclusively breastfeeding since my pump broke, and this is my first child, and I just want to make sure that I have an adequate amount and that she's when she's at my breast. So this is a perfect answer to what we talked about before when it comes to when you're pumping, you're looking at the milk. So her pump broke, so she was looking at how much she was feeding the baby and feeling reassured, looking at the ounces. Now that her pump broke and she's feeding at the breast, she's concerned that she's not making enough. And how do you know that the baby's getting enough? And in my program, Simply Breastfeeding, which is my online breastfeeding class, many of you have taken that. If you guys have taken Simply Breastfeeding, go ahead and say, I took it. I want to see you say, I took it. Anyway, if you've taken that class, there's 4 ways that I tell people to know that to check to see that your baby is getting enough. And those 4 things have nothing to do with ounces and have nothing to do with clocks. All right. Clocks were invented much later after breastfeeding had been done. Okay. What did we do when there were no clocks? We still knew how to breastfeed our babies. We don't need to be watching the clock, but the ways the ways to know that your baby is getting enough, 4 ways that I always talk about. And the first way is when you start a feeding, get in the habit of just feeling your breast, just doing a quick, feel how full you are. And when the feeding's over, feel your breast again, and it should feel emptier. Okay. And if the pillow or, the baby's clothes are not soaking wet with milk, then it went in. It was there and now it's gone and it went in. And so that's a really good way to know that your baby's getting milk out of your breast. So that's just the first sign. The second sign is while the baby's eating, you're going to be listening for audible swallows. You want to hear, and it's not just about how the jaw is moving. You hear a lot about the jaw is moving a certain way. I want you to listen to hear, is that baby transferring milk? And the way that sounds when the baby's actually swallowing, it sounds like a in their throat. You can actually hear the milk going down. It's not a breath. The baby's breathing through their nose. It's something in the throat that you'll hear, that those audible swallows if you're listening. Some babies are really loud with that. On my Simply Breastfeeding class, I actually recorded the baby swallowing so you could hear what a swallow sounds like. But if you're hearing a lot of audible swallows and you get really good at it, you can tell when you've had a good feeding because you can really hear those swallows going down. All right, so they're gulping fast. So that's the second sign that they got milk. The third sign is the baby comes off the breast satisfied, which means that the baby is relaxed. The hands are relaxed. The baby is looking milk drunk, coming off with the milk. And that doesn't mean that they're not crying, because sometimes they will come off the breast. They need to burp. They need to be soothed. They're tired. There's other reasons why they cry. But the best way to test that is, if they're crying, put them back on. If they go back on and fall asleep immediately, they're not hungry. All right. That's a great way to tell. So that's the third sign. And then the fourth sign is the wet diapers. And that's really the place where you can quantify this. If you really want to quantify it, and you should, is to watch and monitor your baby's wet diapers to make sure that they're peeing at least 6 to 8 times in 24 hours. One way you can do that that's really easy, because I hate for moms to have to really count anything. Unless there's a problem, take in the morning. Here's a good tip. Take in the morning, take your diapers, whether they're cloth or disposable, doesn't matter. Take a pile of like 12 and just keep them in one spot in a pile. And throughout the day, just keep taking and using from that same pile, so that if you have a question in your mind, how many diapers did we go through? You can just go look at the pile and where you started with, versus having to write every single thing down.
I love that idea. I love that. Just subtract. That's it.
Subtract, and only subtract if you feel like, if you're getting like constant wet diapers, don't even think about it. But if you're constantly going, I don't know, was there enough? Is there enough? Was it only 5? Go look at the pile, and usually it was a lot more than that. You just don't remember doing it because you forget how many times you've changed that baby's diaper. But I really think that making it easy on yourself, so that you're not watching the clock, so that you're not trying to pump out milk to somehow understand that the baby got enough, it's not the answer. It's really not the answer. Those 4 ways are, Dominique just said thank you. So she's watching. So she just heard her question. I'm glad you were here to hear the answer to that. Yeah, you're doing a great job, Dominique. Just keep going. You're doing awesome. I'm kind of like, I'm not happy that your pump broke, but I'm happy that you've gone back to exclusive breastfeeding. It's better for you, better for the baby, because it's going to be good for your milk supply. The baby is eating at the breast, which is so much more than the milk. I mean, the mechanics of breastfeeding are so beneficial to the baby's mouth, jaw development, to the immunities that pass back and forth from mother to baby. There's so much about breastfeeding that's beyond just the milk. And so I'm happy that you're doing that. And when you need to use your pump, you get a good pump and you'll use it. We're going to have a great episode coming up with Dr. Anna Patras. She is my children's orthodontist, and she's like the most amazing woman. She's just so knowledgeable, and she's just a huge breastfeeding advocate, and she does a lot of work, not just with orthodontics, but about jaw development. So she sees children later on with like their jaws all not developed properly. She fixes that with retainers and bites, and her whole conversation about breastfeeding and how that impacts their whole facial structure and the way they breathe, whether it's through their mouth or through their nose, and all of that is just so fascinating. And so she's actually going to do a show with us this month. I think beginning of April, might even be next week. I got to look at my calendar, but I'm going to be putting that up on my Facebook page here as a event, because it's going to be such a good show with Dr. Anna. So looking forward to that. Totally looking forward to that. Should we do one more question? It's 10 o'clock already.
Let's do one more. Just one more.
Okay, let me find one more. Okay. So Doreen asked the question, Would you recommend pumping while nursing at the same time? I heard this was a great way to increase production.
Like pump on one side and feed on the other side? Is this what she's asking?
Yeah.
Less is more.
Less is more. Well, here's what I would say about that. I would say that if you have to pump, then that's a good time to do it. Okay. If you're asking, should I pump every time I'm nursing the baby? Then the answer is no, that's unnecessary. You don't need to do that. But if you're looking to get some milk out with your pump, if you're, needing to store some milk, or you are, you're just trying to create a little bit of a freezer stash with that, then doing it while you're nursing is going to be the easiest time to pump, because, and this actually answers Yoshi's question, which asked about the dynamics of letdown. So if each breast works independently, why is it that when I have a letdown, it happens on both breasts simultaneously? So this answers your question too, Yoshi. So we'll answer it. So we got a 2 for here, 2 for 1. Okay. When you pump or when you nurse, okay, especially when you nurse, you are triggering a hormonal response in the brain. So the stimulation to the nipple initially when the baby latches on or the pump starts stimulates the brain to release the hormone oxytocin, okay, the same hormone that, works on your uterus when you're in labor and to contract your uterus. That same hormone gets released and quickly goes back to the breast and contracts all the little muscles around the milk ducts that causes a letdown. Okay, and that's how your milk starts to express. It's not from pulling the milk out with the pump. What you're trying to do is stimulate the nipple, which has nerve endings that then trigger a message to the brain to release oxytocin. So that is not independent of each other. Although what Yoshi was describing was, are the breasts independent where one side can make more than the other? And if you nurse on one side more, will it? Yes, that's independent. The supply is dependent, but the letdown is the letdown. And that's why, when you nurse on one side, you may see that you're leaking on the other side. Both breasts are letting down at the same time. And so one of the easiest ways to pump is to put the pump on while you're nursing your baby, because your baby is so effective in creating that letdown reflex. And then the pump will just work that much easier. And we actually work with a company called Rumina Nursing Wear. We did a giveaway on that this week, and they have these amazing tanks and bras, nursing bras that you can pump with or nurse with at the same time. Mm-hmm. So that's really great, because then you don't have to hold the pump. You could just put it on and nurse your baby and be with your baby. So that's my answer to your question, Doreen and Yoshi, all at the same time. See how fast this hour goes?
So quickly.
And aren't they amazing? Everybody in the chat room, how much I love them all so much. They're just an amazing group, and amazing questions and great support for each other. And aren't they wonderful? Isn't it great to be able to see them?
They're wonderful. This is so much love.
I know.
So much love.
It's awesome. So awesome. Well, I just wanted to say, thank you so much, Shannon, for being with us tonight and for going through all, finding a good place to do this and getting ready and, coming on here and learning your technology to be on with us tonight.
You forced me to open my computer.
It forced you to open up your computer, and there's a lot of mamas out there that are really happy that you did that. And
thank you. It's definitely my pleasure. It's been an honor, and I've learned something today too. So
yeah, it's awesome. Well, we would love to have you back again. We're going to be doing a lot more shows coming up on all different topics, and they're all thanking you here. And I'm thanking you very much for being here. And for everybody out there tonight, thank you guys for joining us once again. If I didn't get to your question, I will try to answer some more online, and then I will be back this weekend. I don't know which day yet. I'm going to figure that out tomorrow. Probably Sunday night. We're going to do something special. So just watch. Make sure you're getting notifications. Make sure you went and got your entry in for the breast pump. Going to be announcing that tomorrow morning so that you can win the pump. You definitely want to win this pump. And then pay attention for this weekend because we'll be back again this weekend. Okay. So I'm going to say goodnight to everyone. I love you all. Thank you again, Shannon. And good night, everybody.
Thanks for having me. Bye, guys.
Bye, everyone. Good night.
Night.
Thank you.